Hi guys, my name is Dr. Chris from the local doctor, and I wanted to talk to you today about fever in children. So first off, what is a fever in a child? We define a fever as being a temperature over 38 degrees. Now there's a few ways to measure that, the most common being with an oral or an ear thermometer, and that gives us a really accurate reading of what we call the core body temperature. There are also, underneath the tongue thermometers and also under the armpits, although they can be slightly less accurate and give a slightly lower reading. Now, although there can be many different causes, 99% of the time we're talking about an infection, which is either something like a virus, the same sort of thing that causes the common cold. Now with viruses, of course, for the most part, we can't treat those. We can just make the child feel better while they get over the illness themselves. And also bacterial infections, for which, if needed, we can use antibiotics to make those infections go away. Now we'll be talking a bit more about the differences between viral infections and bacterial infections in another video. Now the next question, of course, is what is bad about a fever? So badness. Okay, so badness is very occasionally a fever can cause what we call a febrile fit. Now, a febrile fit is something I'll go into in another video. It's an uncommon reaction that children have to a sudden increase in their body temperature, in which they have a fit. It's extremely distressing to witness an event like this, and of course a child that has a febrile fit should be immediately examined by a doctor. But in simple febrile fits, although distressing, they do not cause any long-term harm to your child, and please watch my video on febrile fits to learn more about those. So, badness with fever, there is a small chance of febrile fits, and also in children under 3 months old. Under 3 months old, we take fevers in children under 3 months old a lot more seriously, and by that we're talking about a temperature of 38 degrees, of course. And the reason why we take them seriously is not because fever in that age group is any worse than fever in a 9-month-old or fever in a 10-year-old. The reason is that under 3 months of age, it can be very difficult to tell if a child has a life-threatening infection like meningitis or urinary tract infection, those sorts of things, and that's why it's always important to take temperatures in that age group very seriously. A child is not going to spontaneously combust, with a temperature of 40 degrees. They're not going to melt, and there's absolutely no evidence that a fever by itself will cause any long-term damage, brain damage and things like this that parents commonly worry about. Now what I'll do is address a couple of questions that I get all the time with concerned parents and fever. Now the first is how high is bad? Okay, so how high is bad? And I get this a lot with parents. Usually sort of over 40 degrees, parents and some doctors as well can become concerned. Now, going back to sort of everything I've said about fever, the height of the fever is not an important part of that fever. So children, children can have a normal temperature, a temperature of 37 degrees, and have appendicitis, meningitis, bad serious cause of infection that need urgent attention. But at the same time, a child can have a temperature of 40.9, so a very high fever and have nothing more serious than a runny nose. So it's not the height of the infection it's not the height of the fever that's important. It's what's causing the high fever, and that's why it's important to always be checked out by a doctor. There are a couple of ifs, buts or ands with how high is bad. That's not because a high fever is of course any worse than a low fever, but just because, as I was saying, temperature of 38 in a child of under 3 months is of course a cause for concern, so we've got to find out exactly what's causing that temperature. And also in a similar respect, children that have a temperature of 39, for example a girl under 2 years of age, there's a slightly higher chance of a girl under 2 having a urinary tract infection, for example, if they've got a temperature over 39 degrees. So it could be worthwhile talking to your doctor about whether a urine test is worthwhile doing. But the height of the temperature, apart from ruling out those bacterial infections that need treatment, is not important in terms of how ill your child is. Another question I get asked really frequently is in terms of Panadol and Nurofen. I usually give my child Panadol and Nurofen when they've got a fever. It takes the fever away, and that's not happening this time. I've given them Panadol, they've still got a temperature of 40.3. Does this mean my child has a worse illness? And that's a pretty logical way to think. To explain why that's not the case, the biggest point with this is that Panadol and Nurofen actually are far less effective at treating fever than we think they are. And most research shows that Panadol or Nurofen at most can bring down a temperature by 1 degree Celsius, so a temperature down from 40 to 39. And anything more than that is a natural rise and fall of temperatures. Now, temperature normally goes up and down, like that. And the reason why we think Panadol and Nurofen work so well is we often check a child's temperature when they become quite irritable and grizzly and that sort of thing. And that's usually on the sharp upstroke of a fever. So a child's playing with the little toys, they suddenly become grizzly, you feel them, they're quite hot, you check their temperature and they've got a temperature of 39 degrees, say here, and you think, oh my gosh, better get the Panadol and Nurofen, and then you check it an hour later, they've got a temperature of 37, you say, thank God for the Panadol and Nurofen. Whereas most of that rise and fall has actually been the natural rise and fall of that temperature anyway. And then in terms of why then it sometimes doesn't work, well, sometimes just that natural rise and fall is slightly different. So say for example, instead of that, perhaps you've got a curve like this or something like that. So you gave the Panadol or the Nurofen here when it was at 39 degrees, and then you brought that temperature down so that the graphs changed to that, so it's come down a little bit. But then when you check it later on, you know, it's still 38.3 or something like that, and it could have been a degree higher, but there's still a fever. So we've talked a lot about fever. Well, we've learned a lot about fever, but what the heck do I do then when I've got my little girl with a temperature of 39.5 and she's really grizzly? Well, as I said, it's not about treating the fever in itself, it's about treating the symptoms. So, you know, we can use Panadol and Nurofen. That's not to treat the fever, because the fever in and of itself is not important. It's because, for example, if you've got an 18-month-old, you know, who might have a sore throat or might have a sore ear behind that fever, if we use Panadol and Nurofen, you know, we can help them with pain or discomfort they may be experiencing, and that might increase their drinking. So that's a really good idea. Keeping their fluids up is the mainstay of any care of children with fever, and of course getting a child with fever checked out by their doctor. Once again, that's not because fever is a bad thing, but just finding out the cause of that fever, making sure that it's a virus and not anything that needs to be treated with anything more serious than that. We don't want to actively try to bring down that temperature. So I've heard lots of stories from you know, putting them in cold baths, even dipping in alcohol. You definitely shouldn't do that. To you know, taking all their clothes off, through to sponge baths. The aim is not to treat the temperature, the aim is to treat them in themselves. So avoiding all those things, keeping up their fluids, using Panadol if you want to address their discomfort, and of course getting them checked out by a doctor to make sure we know the cause of that fever. So guys, I hope you've enjoyed this quick talk about fever and also learned a little bit. Please feel free, don't hesitate to come in and have a chat with me in person to talk more about these issues. Get your little ones checked out to find the cause of the fever, and of course have a look at all my related videos on the subject. Thank you, and hope to see you soon.